chance to meet. I got a chance to meet. Thanks, man. You beat me to the punch. I got a chance to meet, Phil Chrysler. He's the CEO of Impact Healthshare, and I also, anyway, we had a great conversation. I literally probably held him hostage for like an hour backstage, and then when I saw him in the outside, same thing. And so we're very excited. This will be the highest billing service in the history of ACN, and there's a lot of people that want to learn, right? Want to learn. It's uncharted waters for us. So I don't want to waste any time because we don't have too much time. So I just want to turn this over to the president and CEO, Phil Chrysler. Thank you so much, Phil.
Thank you, Efron. Can you hear me okay?
Perfect.
All right. Well, thanks everyone for joining us today in this discussion about healthcare sharing. It's a critical topic, as you know, right? We addressed the reasons why at the convention. It's a very, very high concern for many Americans. The number one concern, the number one reason, unfortunately, for bankruptcies today in America are due to medical issues and bills. And so incomes healthcare sharing is kind of a alternative to the high cost of health insurance. We're seeing anywhere from 50 to 70% savings, less expensive than that. So there's a natural interest in that. Here's how it operates differently, though, than health insurance. It's based on the voluntary monthly contributions of that community. So every month with Impact, you make a contribution into your member-owned account. You don't send in a premium check to a big corporation. Nope, you make that deposit into your member-owned account. You give us permission to pull the administration costs and to run the program, which pays the vendors, including our newest marketing partner in ACN. But then the majority of the money stays in your member-owned account. So when you're matched with another eligible medical expense from another member, that money is pulled out. Now you're notified. So what we call publishing, you're notified, and then 3 days later, that money comes out. So it's completely transparent. You see for the first time how 100% of all the money moves in a healthcare organization. And so we are so proud to provide that transparency with Impact and be a leader in healthcare sharing in that regard. Because the members are paying monthly for the other members' medical expenses, there are no guarantees. So, what does that mean? Well, it's a risk versus reward concept. The risk is I cannot say I'm going to guarantee that every eligible medical expense will be paid. Why? Because I'm not paying it. You are as a member. So the reward, though, is the 50 to 70% savings that you get. And I would argue that a direct selling entity, and certainly ACN, is best poised to make sure that that entity has new occurring members every month. ACN specializes, really, I think, leads the industry in customer acquisition. And so other good healthcare sharing organizations spend millions of dollars on advertising and get a certain percentage of them to join. You actually have control in this, word of mouth campaign to control that. That's why I think there's such strong alignment between a healthcare sharing organization and the ability for a direct selling entity to serve its members. So no healthcare sharing organization can provide that guarantee. That's only done with insurance. So I want to make that clear. If there's somebody out there that says, well, I need a guarantee, sorry, that's not Impact Health Sharing, and that's not any other healthcare sharing. It is that risk versus reward concept. So you should know that, but also be proud of that, because it's dependent upon the community and new members coming in every month, which all of you control those efforts. So what's also cool is, it's a not-for-profit. So I don't have any conflict between my members, what gets paid. In fact, Dr. Maharaj who leads our efforts in billing, is paying our providers in 18 days, and we're trying to get that down to 15. There's no motive to hold on to that money. Let's push that money back to the provider and make you a good customer in that regard, right? There's no conflict between shareholders, between the executive committee. Everyone's paid fair market value. That's it. Salaries are it. There's no other money coming out of the organization like there would be in a for-profit. So that is good for you as a member. The Department of Health and Human Services says 5% of the population drive nearly 50% of the medical spend that occurs today. What does that mean? That means, quite frankly, the majority are overpaying for something that they don't use or rarely use. And so we can be a very meaningful alternative to those families to help them reduce their costs. So that's healthcare sharing and all the positive aspects of why it's such a powerful alternative to health insurance. And so, what makes us a little unique in the industry is we're rooted in the love thy neighbor approach. Okay, what does that mean? That means we can welcome all races, religions, colors, creeds. There are very good brother and sister healthcare sharing organization that are religious based, not ethic based like we are. That means they will only allow your particular religion into their community. And in some cases, you got to get a signed affidavit from your pastor. Not so with Impact. We want to grow the community. We're inclusive to allow more in that can participate and benefit truly from what healthcare sharing and specifically what Impact offers. So proud to be that. We have this best-in-class technology platform. We're the very first healthcare sharing organization in the United States to roll that out, where they're member-owned accounts. We don't pool resources like insurance or even some other healthcare sharing organizations do, but I would argue really shouldn't. So that's a powerful thing, provides, again, transparency in that regard. No network, so you can see any doctor you want, which is terrific. So we have great choices for individuals, for families, for seniors. We have a great senior program. And then for small businesses, we have great opportunity, dashboard and programs that will suit them, that we have someone on staff that presents on your behalf, those pricing and programs. So it's a comprehensive program. It has preventative services, maternity, accident, illness, injuries, includes free telemedicine access, and really industry leading prescription prices, prescription drug pricing, which Dr. Maharaj will touch on in just a little bit. So we're looking, who are we looking for? We're looking for obviously anyone who is relatively healthy to healthy, and that has to pay for all or most of their health care, right? There's a really good chance we can help them save a lot of money. When we help them save, guess what? You get to earn a lot of money, and there's nothing wrong with either one of those components. So I think it's perfectly poised to serve America today in its hour of need of trying to reduce healthcare costs and expand ways for families and businesses to earn more money. So I couldn't be more excited about that. Insurance obviously is no longer affordable. 80% of US adults ranked it as the #1 concern for their particular family, top concern. And here's what's good. This trend is on your side, right? We're seeing more gig workers. So they're shifting, right? The quit rate is at an all-time high right now. That they're looking for access to affordable healthcare. It's essential to them. And now you have that opportunity to help them, again, in a very meaningful way. And then regardless of the US economic cycles, right, we're in a, obviously an inflation, but whether stagflation happens or we enter into a recession or a depression, whatever Asian or Eshin happens, unemployment typically follows. And that means more and more people continue to look and evaluate how they can reduce costs, and healthcare again is the number one option that they're looking for. So the great news is our memberships are portal, so you take it with you. If you're an employee at an employer-sponsored plan and you decide to leave that job, you can take your Impact membership with you. It's portal. So that's terrific. And you should know this about healthcare sharing. Memberships over the last decade have grown 1,000%. And there's no stopping it, because we don't see all of a sudden a national reduction in healthcare costs and healthcare premiums. It's not happening. It's just the opposite. So yeah, the process though, when we launch with ACN, it'll work very, very similar to the Sphere process. Okay, so you don't have to be a healthcare sharing salesperson and understand all the ins and outs and specifics, because there's a lot to that. We get that. We want our sales team to be able to tell them what we are, tell them what they're not, what we're not, and to send them that information and that application process. And then we report to you the status in near real time, what's going on with those leads. And so that's that's built right now and being integrated with ACN, so we can report those statuses with you, which I think should be terrific for you. Know that you don't have to know all there is to know for healthcare sharing. There will be an accreditation process, because we want you grounded in some level of knowledge. But that's an easy 10-minute process with I think 30 questions at the most. So yeah, so we're excited to really go out and what we think is about 90 million Americans who don't have group insurance, who don't have any insurance, or who are underinsured. And so we can be a meaningful alternative and serve and help while helping yourself in this environment that we're in with Impact Health Sharing. So with that, I just wanted to say thank you for the guys for giving me a time. I want to turn it over to our Vice President and Medical Director, Dr. Maharaj, if she wants to add any points that I have missed, or talk specifically maybe about the guidelines so people know, right? And anything else you want to touch on. So Dr. M, take it away.
Thank you, Phil, and thank you, Mr. Tejada, for having us on this Zoom, and to all the participants. We're very excited to have ACN and to partner with you guys, and it seems like you guys are equally, or if not more, excited for us, so we're happy to have that. As Phil mentioned, we don't expect you to be an expert on health sharing. We don't expect you to know our guidelines in and out. We just want you to be somewhat familiar, and then kind of send it our way, and our enrollment team will kind of take it from there. But I do think you should be somewhat familiar, not an expert, but familiar with our guidelines. So I can share my screen and show you guys how to access them. So if you go to impacthealthsharing.com/guidelines, you can see the tabs that kind of break down the sections, or you can just hit download guidelines, and it takes you to our PDF version, which goes over everything that we share into, our provisions or stipulations, and everything else that you can see there for yourself. So if you ever have someone that has a specific question and you may want to help them find it, likely the answer will be there. One of the things that I did want to talk about is prescriptions, because Efron did ask us to talk about that. So as Phil said, we do have a very competitive prescription saving plan that is in every comparison that we have done cheaper than GoodRx. And there's even, I believe, a GoodRx Gold, which is the GoodRx plan that you actually pay for. We are cheaper than them in almost every instance. So pretty great rates right off the bat. As far as how we share into those, prescriptions related to an eligible expense, of course, are eligible for sharing. Essentially, after the first $25 for prescription, generic medications, $50 for branded medications, assuming that a generic is not available. We do have, members would pay 100% of the prescription costs at the pharmacy, and then they would submit that to us for reimbursement. We do not share into psychotropic medications and birth control as of right now. We also have our sharing is limited to $1,200 per member per membership year once the PRA has been met. And PRA is what we call our primary responsibility amount, which is similar to what would be a deductible in insurance terms. Now, even if you've met that $1,200 shareable limit, you still continue to receive that discounted benefit. So that's through and through, regardless if you've met that. And regardless if that medication is eligible or not, you will still get access to our prescription saving plan, which is, like I said, it's pretty good and very, very competitive. We do have some provisions in place. If you are a transplant recipient or a cancer patient, we understand that you can pretty quickly get through that $1,200 sharing amount. So we do have provisions in place for that. So that was our prescription benefit. One of the other things that I do want to highlight that I think is kind of helps us stand out from other healthcare sharing plans is that we do allow wellness visits. In fact, our wellness, we get one free wellness visit every year per member. And that's paid or shared into at 100% by Impact's members, regardless if you've met your PRA. And again, that's kind of what we call the deductible. Whether you've met that or not, we share at 100% for your wellness visit. And not only that, we also provide you with $150 credit to use towards some of your routine labs. And the list is here in our guidelines. So that's pretty significant. We understand that wellness is important. Preventative medicine is important. Seeing your provider, not just when an issue arises, but keeping those appointments regularly to make sure that there's nothing else going on with you is key and has been proven to reduce long-term things. So that's something that we share into that we're very proud of. We also share into visits for kids. And then as Phil mentioned, we do share into other screening and wellness things like pap smears, mammograms, PSA, colonoscopy. And again, these things are very important for you to get regularly or as the guidelines dictate, not our guidelines, but which also aligns with medical guidelines. Because you want to make sure that you're healthy and that your men are getting their prostate screening and women are getting your mammograms. Those are very, very important and have been proven. So we share into those, we understand that. If there's not any other specific questions, I can continue unless you guys want me to go over anything else.
Yeah, why don't we keep going? And then maybe if we have time, we can get some questions answered.
Sure. So we talked about that. One of the other things that we have that we are changing some of our guidelines. They will be starting May 1st. So if whatever you see here in the next couple of weeks, you should also be able to download our guidelines that are coming. And with those guidelines, we are actually improving on what we offer, not taking away anything. We're actually improving. So as of right now, pre-existing medical conditions are not eligible for sharing. The way we define pre-existing conditions is anything in which you've had signs, symptoms, treatment, medication, diagnosis, testing in the previous 36 months. And let's say you have cancer and you get an annual CAT scan. As of right now, and that's just for surveillance. You're done with your treatment, your cancer is in remission. According to the guidelines, the way that they are now, that would be considered a pre-existing condition. However, again, we take feedback from our membership. We are always trying to improve in what we have. We heard that people weren't, so thrilled about that. So we're changing it. We are starting May 1st. For cancer diagnosis only, let's say you have liver cancer and it's been in remission, you're without treatment. Your doctor just wants you to get a CAT scan every 6 months or every year, just to be sure that everything remains at bay. With the new changes that are coming, we would not share into that for the first 36 months. However, if you remain a member for 36 months and all you're getting is that annual or biannual screening test, that entire cancer diagnosis, heaven forbid, if it comes back, will be eligible for sharing. So we will share into that entire cancer diagnosis, which is big. We understand that is important for our members. We don't want them to not get those screenings because they're fearful of it being a pre-existing. We understand that, we heard what they were saying, and we're making that change. So that's something that's coming pretty quickly. One other highlight that I want to make that's really, really great, and I do also think helps us to stand out, is we do share into therapy, chiropractic, physical therapy, occupational vision therapy, speech, respiratory, and as well as cardiac rehabilitation. And it's 50 visits per member per membership year. So if you're a household of 2, for example, me and my husband, I can see any one of these combination of 50 visits, and then he gets 50 visits for himself, which is really great. I know a lot of people value seeing the chiropractor. They go for that for multiple different treatments. And so we share into those, as well as speech therapy. If you have a little one, maybe they have a delay in speech or something else going on, that's a great thing to have. As well as physical therapy, occupational therapy. Heaven forbid you have surgery, you need a little assistance with getting back on your feet. That's available to you as well. And then cardiac rehab, which is also a great thing. Heaven forbid you have to have cardiac surgery. We share into that as well. We also share into skilled care and home health services for 40 visits per membership year per member, which is also a great thing. Impact also shares into hospice, $15,000 per member, and that's a lifetime thing. So we're treating you, and we have offerings essentially from the moment that you're born or even into pregnancy up until end of life. And again, we understand that that's valuable and it's a great thing to have, especially in that situation. The last thing you want to worry about there is having to, put that money out there for hospice. We do share into that. Let's see. Anything else, or you want me to keep going?
Keep going.
Okay. Let's see here. So, let's see. Oh, so pre-existing. 2 things that I do want to highlight is high blood pressure and high cholesterol. So while I talked about pre-existing things, if you do have high blood pressure and high cholesterol, but it is well controlled with medication, we do not consider that a pre-existing condition when determining eligibility for a future vascular or cardiac event. For example, let's say you have high blood pressure and heaven forbid you end up with a stroke. We're not going to say, as long as your doctor can attest through medical records that your blood pressure has been adequately controlled on medication, we're not going to say, wait a minute, this stroke is related to your high blood pressure, therefore it's ineligible for sharing. It's related to a pre-existing condition. We would share into that. The other example would be for high cholesterol. Let's say you've been on cholesterol medication for several years. They work very well. Your cholesterol is well controlled, and you end up with, say, a heart attack. We would share into that, again, as long as your provider can attest that your your high cholesterol was controlled with medication. We would share into that cardiac expense. No issue. I do want to talk about maternity for a second. So we do share into maternity as long as you've been a member for 12 months. So what that means is, let's say you join Impact January, you end up getting pregnant in April. We go based off of your due date. So by the time you were to deliver, you would be well past being a member for 12 months. That would be an eligible pregnancy. We do have $150,000 that would be attributed to that single pregnancy event. And one of the things, again, we try to be very, very member-centric. We try to take things into consideration. We take feedback from our members, and we also try to put ourselves in the shoes of people that are going through difficult times. So one of the changes that we will be adding come May 5th is, previously the medical bills of a baby that would be added to membership at birth would be included in that $150,000. But we understand, heaven forbid that baby needs NICU attention. That's very expensive. So we removed the baby from that $150,000 limit. And now the baby has the same benefit or same sharing amount as any other member. So they can have that NICU care, and the parents don't have to stress about the medical bills. So that's something that we'll be adding come May 1st. So a newborn added at membership would be allotted the same sharing amount as any other member. A lot of other healthcare sharing organizations limit NICU spend. So that is something that, again, sets us apart from the rest. So that's something else that I just wanted to mention. We do require pre-notification for certain things. if you're having cancer treatment, elective cardiac procedures, inpatient, outpatient surgery, non-emergency admission to a facility, organ transplant, as well as maternity. And all that pre-notification means is that your provider has to call us, let us know that you have one of these treatments coming up. And we just ask for some codes and we keep it in our system. Pre-notification does not imply that we are telling you that it is in fact eligible. It just allows us to keep track of things. And if we need to work with the facility to get other things lined up for you, it allows us to do so. And this information is located on the back of your card. So your provider has that information. Let's see. There's a lot of information here, so you guys can always reference that as needed. Dr.
Maharaj, while you scroll down, what about natural births?
Natural births meaning?
Like a home birth, water birth?
So we do share into, let me find it here. So midwives, so if you're using a licensed midwife, if you're using a nurse practitioner, sometimes they also do home births, or a medical doctor, doctor of osteopathic medicine that does home births. We will share into the cost of the delivery. Great. Maybe not some of the other things that go along with that, but we will share into the provider's fee and the delivery fee.
Great.
As long as they're a licensed midwife or meet one of these requirements. But most of the time, if it's a licensed midwife. I do have to just jump off. I have a member that's having a procedure and the facility is calling me. So I am going to jump off for just a second. Okay, I apologize.
Okay, no worries. Phil, are you there? Perfect. This is a good time. You're muted. Hold on, let me unmute you.
I'm good.
Okay. Oh, that's pretty cool. I got it. I got to highlight Phil. Okay. So is there anything that you want to add, Phil?
Let's talk about and I know we're really into the weeds here. I hope that's okay. Let's talk about what happens. A member gets a member card, okay, when they become a member. So membership begins the very first of every month. There is no open enrollment, constraints there. Every month, you join memberships. You just got to complete the application process by the final day of the previous month in order to begin membership on the first day. And then a few weeks later, you get your card, and then Impact is loaded into every clearinghouse. So what does that mean? That means when a provider or doctor office should look, they'll see that we have a payer ID for them to EDI us, send us electronically your medical bill. Sometimes it doesn't, 92%, I think it happens like that, where we either get it sent electronically or it's mailed to us. And then for about 8% of the time, the person doesn't feel like looking for whatever reason, and there's a little bit of conflict, but it's we have other paths to work through that, so you should know that. But even though we're not insurance, we've set up Impact to work just like it, where you show them your card, and on the back has all the payer ID, because we're loaded into every clearinghouse that we need to be for them to EDI us the bill. So that's a nice difference compared to perhaps some of our other good brother and sister healthcare sharing organizations.
I do see some of the questions here in the chat. If you want us to address those, we can.
Yeah, if you're ready to go, if you're ready to stop sharing your screen, you can start answering some of those questions for sure.
Sure, excellent. So we have, it's like someone mentioned here, if there was an age limit to joining Impact, we do not have an age limit. However, when you do turn 65, once you turn 65, you would then be transitioned into the Impact for Seniors program, in which case you would have to obtain Medicare Parts A and B, traditional Medicare. And we would be sharing secondary to Medicare. So that would be that, but we do not have an age limit. And a lot of the stipulations, once you are in the senior program, kind of go out the window, if you will. One of the biggest things is the pre-existing medical conditions. Once you're over 65 and in our senior program, we do not, the pre-existing stipulation kind of goes out the window, that provision goes out the window. We share into anything and everything that Medicare does. So it's, I think, a great comprehensive program for seniors that probably can't afford to have a supplemental coverage, and instead of being stuck with the 20% that Medicare doesn't pay into, it's a great option. Let's see. Somebody asked if do we have a list of pre-existing conditions. No, we don't have a list of pre-existing conditions, but we do have the definition, because it's not that we'll never share into diabetes, we'll never share into lupus or multiple sclerosis. It goes based off of those stipulations. And the way I like to kind of think about it is it's 6 buckets. And those 6 buckets are signs, symptoms, testing, diagnosis, treatment, or medication. And that's for the previous 36 months. So if your condition falls into any one of those 6 buckets, then it is considered a pre-existing condition. So that's kind of how we look at it. So we don't just say never sharing into lupus, never sharing into what have you. It really depends on whether or not you fall into any one of those categories.
Yeah, and let me just add something, Dr. M, is that you're still allowed to become a member. You still can join membership. And even though it's those aren't eligible for sharing, those bills will be repriced on your behalf. So we will lower those costs. And then, of course, any additional injury or ailment that arises that's not related to that is going to be eligible for sharing. So that's a nice member benefit as well that separates us from some others.
Yeah, a couple people asking here about diabetes. So diabetes, as long as you are actively on having signs, symptoms, treatment, medication, anything that falls under those 6 buckets would be considered a pre-existing condition. But again, like Phil mentioned, impact really, truly, the way you should look at it is we have 2 provisions. We have 2 things that we offer. One is the sharing aspect, which is great. And the second thing is the repricing aspect. So while the diabetes, if it fell into the pre-existing category, would not be eligible for the sharing aspect of it, it is 100% eligible for the savings aspect of it. So your bills will be repriced. You'll be able to use our prescription savings program to get your medications at a discounted price. So you still get access to all of that. So it's good to know that.
And we have members that do that today.
Yeah. Real life scenario. And I'm not by any means telling somebody that's diabetic to drop their insurance, because that may not be the right thing. But we had a gentleman was paying $1,800 a month for traditional insurance. He's a type 1 diabetic. He had been a diabetic from a child, so he's managing it, familiar with how he does. But the insurance was charging him so much money for his prescriptions that between the savings that he would be saving a month for between the premium and our monthly share, he decided to drop his insurance and join ours, because he said, I'm not really planning to have any issues with my diabetes. It's been well controlled. I've had it since I was a child. And the prescription were actually cheaper with us through our savings program than it was with his insurance. So he decided to do that and was saving well over $1,000 a month. Let's see, dental care. A couple of people asking about dental care. So I'm going to throw dental and vision into one. We do not share into dental and vision unless it's a medical diagnosis. So the kind of the example that I provide is for vision. If you need glasses, that's an ophthalmology related diagnosis. However, if you have cataracts, that's a medical diagnosis. So we would share into that. Same for dental. If you have a cavity and you're requiring a root canal, that's a dental diagnosis. However, let's say you trip, fall, fracture your jaw, and your tooth needs repair, that's a medical diagnosis. So we would share into that. The 6, someone asking for the six things. It is signs, symptoms, testing, diagnosis, treatment, or medication. Those are the 6 buckets for the pre-existing, and that's for the previous 36 months. So let's say you had brain cancer 4 years ago. You're done. It's in remission. You are having no medication, no treatment, no symptoms, no signs. You join Impact Health Sharing, and that cancer comes back, that would be eligible for sharing, because you haven't had anything in those 6 buckets in the previous 36 months. Someone mentioned senior program replaced the 20% medical beyond original Medicare. So correct. So you have Medicare Parts A and B. Medicare typically shares into 80% once you've met your Medicare deductible. And then members of Medicare are responsible for the 20%. That's where Impact would kick in and share into the 20%. We do have a PRA level it's just one single level for the Medicare program, and that's $1,000, whereas with our other program, we have a couple different options. So once you meet your $1,000 PRA with Impact, we would share into whatever Medicare does, which would essentially be that 20%. Can you have a HSA with Healthshare? Yes, you can. If you have a health savings account, you can use that for anything that you out of pocket wise, like with your PRA, medications. Of course, you can pay with your health savings account and then submit those bills as you would to Impact for us to reprocess. Let's
Want to
see.
talk about the telehealth, telemedicine
Oh, yes.
aspect?
That's a wonderful provision. Excellent thing that kind of skyrocketed during COVID is telehealth. So we do have telehealth, which is shared at 100%. It's free. It's included. There's no copay or provider fee with telemedicine. It's a great tool for kind of like those middle of the night things, especially if you have little ones or they're having an ear infection or you have a UTI and you maybe just need to get some medication. It's a great option for those types of things. And again, it's shared at 100%. There's no fee to the member. There's no provider fee. So that's a great thing. And one of the other things that I do want to highlight on kind of piggybacking off of that is we also do share into mental health, mental telehealth. That does have a $75 copay or provider fee, but a lot of other health sharing companies do not share into mental health, and we do. There are some, guidelines associated with that, which you can look over more in detail, but we do share into that. And just as one caveat with our telemedicine, and it's no different than with traditional insurance, is for the telemedicine, for it to be $0 for the member, you obviously have to use our provider, and that's through our platform. So that's the only caveat that I would like you to kind of keep in mind. Someone asked about guidelines in Spanish. We do not have them in Spanish at the moment, but we are working on that. That is something that, again, we take feedback from our members very seriously. And so anytime we kind of hear something, we know we got to work on it. And that's one thing that we are working on.
Yeah, we do have a very Spanish speaking. They're very fluent in enrollment, in billing, and in member services. So we're moving towards supporting that initiative, completely 100%. So we wanted to get feedback, see how important it was to ACN, and several organizations have reported back to us that they would love for us to fully embrace that. So we're heading that way.
Do you need?
Dr. M had to go again. Some questions came up that, and I don't know, Efron, if it was from you or different other leaders about non-resident alien, that status. And so if you have, what is it, an ITIN number and a government issued ID from Mexico, Canada, and Guatemala, you're able to open and join Impact. So that is something that has come up a lot in the last week or so. And so we worked with our financial partner who owns the accounts, or who opens the accounts, and gave us a path to help those folks that in that manner.
So just so we're clear, so they can have a U.S. tax ID number, but a passport or any kind of ID from Mexico, say, and that will be good enough? Is that right?
Yes.
Wow. Okay, cool.
Yeah. And again, taking feedback all the time. That was a thing that we've heard people asking about, and then also a lot at the ACN convention. And we took that and figured it out as quickly as possible. And so we're rolling it out.
All right. Any other?
Hey, Doctor, thank you so much. Phil, thank you so much. I know a number of people had asked about, and they're putting it into the chat about the 1095. So I just want to know if we can just address that kind of quickly for California.
1095 for California. So I tried to do a little bit of research before jumping on the call because I saw that was a question. I am not 100% sure. Phil was going to reach out to.
Yeah, I haven't heard back from our attorney on it. I know we have members in California, so let us provide an official response, and then perhaps you can circulate that, or we can put it on the website in the frequently asked questions once we get that the attorney to give us that language. Thank you.
Okay, any other questions, guys, in the chat, please? We can't open it up because there's too many of you.
Somebody asked again, I know Phil touched on it, but I'm going to mention again, because I think I saw it twice now. For doctor's visits, do you have to pay up front? So no, there's some healthcare sharing organizations that require you to do so. We do not. As Phil mentioned, we have a high percentage of the time that the providers send us the bill. We are in all clearinghouses, so they can send it to us electronically. We also have a PO box location where they can mail these bills into, and that's where a majority of our bills, where that's occurring. A small percentage of the time, 8 to 9% of the time, they don't want to do that. And so they may ask you to pay up front, in which case, if you choose to do so, just make sure you get a bill with all the information that we need, all the required codes, tax ID, etc. of the provider, and submit it to us, and we will get that process for you and either apply it to your PRA if necessary, or submit you a reimbursement accordingly.
Is it recommended to let the provider know before you visit them?
Some people choose to do so. It's not necessarily recommended, but if you choose to do so, and let's say they tell you that they're not familiar with impact or they're somewhat hesitant, we do have a provider outreach department which will call that provider. Sometimes it's kind of fear of the unknown, where they never heard of Healthshare sharing perhaps, or never heard of impact. Our provider relations team will reach out to them, let them know who we are, how we work. And we find that that's very successful with them agreeing to move forward with seeing the individual. Of course, we can't force anyone to be willing to do so, but we find that it's pretty helpful.
Sometimes, candidly, you will have, and again, this is 8% of the time we're talking about. So over 90% of the time, it's works great, it's seamless. But sometimes you'll have a front desk person who just, quite frankly, doesn't feel like looking, doesn't feel like doing the work. And so we talked to members at the ACN convention who said, well, let me talk to your supervisor. The supervisor looks, yep, there's impact in the clearinghouse. Okay, we'll electronically send the bill. So, it's tough to say what, but again, we're very proud that, over 90% of the time it's just sent to us.
Yeah,
we just wanted to create a path for those small percentages that wouldn't do the work, or for whatever reason, maybe had a prejudice towards healthcare sharing in general. And so we wanted to create a path for you to, still account for that. And so that's why we have the medical expense form.
Dr. and Phil, I know there was a great question that a number of people have come up with about small businesses, and will there be a way for us to be able to?
Yes, I saw that. I was going to address it, but Phil.
Oh, sorry. Okay.
Yeah, great question. So yeah, we have, our enrollment director specializes in small businesses. So she will actually do the census and get the information and then present impact to them, provide a quotation to them and help them through that enrollment process, so we can serve small businesses up to about 49 employees in that manner. We launched the small, the group program, and we created a dashboard so they have access. And remember, if an employee leaves, Impact's membership is portable, so they can take that with them, which is a terrific benefit to that employee. So, but we have a dashboard created for them to onboard or make changes, add family members, that sort of thing. And so that's all done again for you on your behalf with our in-house team.
I do see one other question that I want to highlight. They're asking if we're covered beyond the state of residency. So yes, we're nationwide. In addition to that, we do share into, if you're on vacation, you're out of the country, and you have an emergency, we will share into that medical expense as well, which is huge. So we have that. And then someone mentioned they work in a clinic in Texas, has a similar sort of program. If they wanted to become a provider, absolutely. We have a couple members who are actually providers as well, and they want to join. We don't really have a network per se, but they want to be listed as a healthcare sharing friendly provider, and we definitely do that. And we filter and funnel members in their area to that provider.
Here's a great story from some of the team national leader in Kentucky. Was as friendly with the CEO of a local hospital, and was trying to get them interested in impact. And he was like, "Oh, I'm not sure about healthcare sharing. Send me some information." And they were like, "Hey, no problem. A lot of our members are just going about 45 minutes away to Bristol, Tennessee. So we can just continue as we build this area. We'll just continue to send them over there." And that CEO flipped on a switch. And I mean, within 30 days, we had an agreement. They were accepting impact. And now the great story of that leader as they're building their local businesses, individuals, families, and seniors, right? They now are, through the word of mouth, recommending that they go to that provider. So that's how powerful, that scenario can work.
Mhm.
Okay, so let's wind it down, guys. Dr. Maharaj and Phil are busy. So any last minute questions, if you can just drop them in the chat. We're going to save the chat. So those questions, we're going to keep them, and then we're going to keep a list of them, and maybe we can get them if the answers written down as they come up. I have a question actually, as people think about it. Let's talk about some cons that will come up, right? Any cons, any obvious cons? This sounds great so far. So
Right. Well, I mean, again, we're looking for the fairly healthy to healthy, right? So we're not looking for everybody, but we're looking for a large growing population, right? That are paying all or some of their or most of their health care. And so, the pre-X limitations, which aren't, too overbearing in our opinion, right? So the con, probably the biggest, is people get a little freaked out of, well, there's no guarantee. Well, I would argue, I've heard many stories that people have health insurance, the so-called guarantee, and guess what? Not everything that they thought was going to get paid got paid by that typical insurance company. So, but remember, we're not the ones paying the bill. It's our members that are paying the bill. That's why any healthcare sharing organization cannot, has to state that they cannot provide. It's voluntary. It's based on those monthly contributions. But if we continue, right, to build a member-centric healthcare sharing organization, deliver on our promises like we intend on doing, that continues to spread, and there's no reason to not be concerned about eligible medical bills getting paid.
So one last thing, if you want to mention to them, Phil, about our November and December, that's a nice.
Yeah, we were told, so the month of November and December, because our medical spend was so minimal compared to what we had in our member-owned distributed reserves accounts, I looked at it and said, man, there's really no reason to collect the majority of dollars from our members in the month of November, in the month of December. Let them keep their money, especially at that time of year. So it was, what was it, $620,000 that our members didn't have to fund in their member-owned accounts. They got to keep and repurpose that money for other things. We've been told we're the only healthcare sharing organization that has ever done that. That's embracing the voluntary nature of healthcare sharing and really saying, hey, if there's dollars there from our members that we have medical needs, we'll use them. But should we collect more or keep collecting at a rate when we aren't even close to meeting those needs? So, meeting those reserves, not needing all of the money. So, and that's the beauty of a not-for-profit, right? That if we don't need your money, why take it? So we're going to look, when March closes, we will sometime in April, we will look back. We'll take a look at, we're going to do this on a quarter-by-quarter basis. We'll look back, see what our distributed reserves are, see what our medical needs are, see what's trending in the pipeline. And if we don't need to collect the need portion of the medical money, then we're just going to say, hey, this month send us 30, 50% less, whatever that percentage is, than you typically send us. So, right? Why take the money from the members if you don't need it? So I think that embraces the true purpose and meaning of healthcare sharing, in my view.
Phil, Dr. Maharaj, I'm getting blown up on my text messaging about anything autism. About is it what's
Yes.
covered, not covered? I just want to make sure that that got addressed because I'm getting out my phone as well.
Sure. So autism, if it's a child that's joining through their parents that already has that diagnosis, then again, that would be considered a pre-existing condition. So we wouldn't be eligible for sharing, but it would still remain eligible for savings. So that's a big bonus there. Instead of paying for, a lot of parents have to pay out of pocket for autism costs. Let's say it's a baby born at birth and ends up with a diagnosis of autism, then that would be eligible for sharing. And then of course, everything else would follow accordingly. If they require speech or occupational therapy, we have 50 visits per membership year. As well as if they require home health, we do have some provisions there. So if it's a pre-X, not eligible for sharing, eligible for savings, which is major. If it is a new baby born into our impact family, it would be an eligible expense at that point. Obviously, still limited to, or not limited, but still subjected to the other provisions that we have in place.
Right.
That's great. Okay, so any other cons? Because the cons are pretty short list.
Yeah.
I mean, everything is there in the guidelines. We are not, trying to get people that join that may not be the right thing for them. So, that's something that our enrollment team will definitely share with people. If you're telling us you're joining, you have cancer, you have leukemia, you're actively having treatment, we're going to tell you this is not for you. Because that would be a pre-existing condition if you have insurance. If you're saying you have nothing, then maybe you do want to join, knowing that that's not eligible for sharing, but those bills are going to be eligible for savings. And you may be looking at $1 million worth of bills, but we can bring that down significantly. So things like that.
Okay. All right, great. So, all right. Anything else, Dean, before we let them go? Everybody stay on, right? We'll they've got to jump off, but we'll stay on and talk some business stuff.
I just think that the part that Dr. Maharaj just shared, I think that's really impactful because that's something that's going to happen for me personally. So just so you guys know, we had a really great conversation, and the fact that there may be something that's pre-existing, if I'm understanding this, I don't want to misspeak, something that's pre-existing that may not be covered may still be reduced. And I just think that's, I'm pretty fired up about what we're going to have the opportunity to do. And I know that you guys are going to get that information about California. Those are a couple of big things for us. So.
Yeah. Okay. And Phil, when do you think we'll be ready to go? When do you think we'll get the green light?
That's an ACN answer. I hear April. April, May. But I know they're working hard at it, so you guys can influence that as well. So, but I know the team is the ACN leadership team, the IT team is working hard to put themselves in a position for an April launch.
Hey, Efren, one thing that I think as well, just really quickly before we do let them go, is I think understanding the relationship between the IBO and impact, and just making sure that people are very clear that really our goal and our job, doctor, certainly if I heard this correctly, and Phil, if I heard this correctly, our job is just to make sure that we give them enough information and get them into your hands.
That's it.
And be the conduit so people can, focus on continuing to build their business and offer something that just as amazing as this is, get it to the professionals.
Yes.
Yeah, it's really about asking those potential people, hey, are they open to other ways to evaluate and perhaps cut their healthcare costs? And if they are, just say, great, I have a pretty cool alternative. I'm going to have somebody contact you and talk to you about that. And it could be just that simple. I'll let you guys decide, what that phrases are and what you recommend, but that's the concept is just, send us some, don't download your address book and they have no reason why they're calling. They're not even looking, don't do that because we've had people do that. And that's not good for anybody, but it's just as simple as asking them if they're open for ways to reduce healthcare costs. And if so, we're going to have a company call you. And if the answer is yes, we'll give them a call and our team will present them what we are, what we're not, and then report that in real time and send them the application process. And really, you're just passing us leads to help you.
Mhm.
All right. I think
All
it's
right.
good stuff. I really appreciate your time, both of you. Thank you so much. I think
Thank you.
it's cleared up a lot of questions for everyone. So,
Okay, great.
Dr. Maharaj, thanks. Phil, thank you so much.
Thank you so much, everyone. Appreciate
Take
everyone's
care.
time today. Thank you.
okay.
Bye-bye.
Thank you so much, guys.
Bye-bye.
Okay. All right. Don't jump off, guys. Let's see here. Hold on. Give me just a sec. Okay. So, Dean, is there anything you want to add here before?
Man, I think we covered a lot. I mean, you guys, we got a lot of questions answered. They dived into a lot of stuff, and I think that if everybody really understands the opportunity in the vehicle that we now have our hands on here, I think this could completely, massively change everybody's business, because we are offering something that's a need that a lot of people can't get. We're going to get a couple of these last remaining questions answered and cleared up, and it's going to be like, it's game time. And we have this, Efren, what I would ask you to share with everybody is the window of time between now and when this launches, because I think that's the most important thing. This window of time that we have between now and when any new service launches, and certainly something as big as this that can have, no pun intended, as big of an impact as this could. So maybe if you want to discuss that, or just maybe touch on that before we split, and how everyone can best utilize this window of time that we're in.
Yeah. So here's what I have to share with you guys. Okay. Dean and Jason and Stephen Payton and some of the other RVPs throughout the weekend, we were just going over numbers. And so just so you guys know, okay, because of this, a couple of people asked about this. If you go to the health sharing, the Impact website, you can actually get a quote. Okay, it's not exact, but it'll give you an idea. Somebody asked that question. Okay, so then you get a quote. You got to punch in your birth date, and then you're going to get a number. And just for us as IBOs, just so you know, that the commissionable amount for us is going to be 40%. So the commissionable amount is 40% of what that quote is, or whatever that quote ends up being. So based on that 40%, that all the numbers that we've looked at, it's going to be the highest billing service we've ever had in the history of ACN. So what does that mean? That means that if you plug in that number, in some cases it's $140 a month that you will receive commission on. So imagine you're going to get paid 20% of $140. In some cases it's $100. In some cases it's $200. That means that we have 300, close to 300 people on the line right now, and that means that some of you who are regional directors, without exaggerating, I mean, you're 6 months away, 12 months away potentially from regional vice president. Some people on the, Dean, for example, Dean's got a great structured business. He's actually got the structure for senior vice president. He's now realistically, I would say under 2 years away from becoming a senior vice president based on these billing numbers. Some of you who are ETLs, man, you could be platinum RVPs in less than 12 months with this billing, right? Because the business, there's two sides to the business. One is structure, right? You need structure if you're building towards SVP, and the other thing that you need is billing. And sometimes, some of the areas are just more profitable. The billing is just better. Energy typically has been very, very good. In Latin America, to give you an example, one customer bills $10. So compare one customer $10 billing to this over $100, 10 times, literally 10 times the billing. So anyway, what needs to happen between now and the time that we launch? Is we all know who those of us who have been around. We have a window right now of excitement to get people introduced to the business, to get customers lined up, right? Because we can get the quotes. And so that when this thing launches, now that I remember, Robert did tell me April. He said the goal was April, everything was looking good, but let's just say it's May. We've got, over a month to prepare for this. I mean, imagine, look at this. That means that if you prepare, if you've got some people lined up, you could jump positions. The next 90 days, 120 days, 6 months could be potentially the biggest months of your ACN business. Now, remember this, I've been around for over 20 years. I've seen people explode. I've seen people go from 0 to 100 IBOs in 90 days. Mike Basutti many times put in 100 IBOs in a weekend, right? Dean Turali has had some massive days. Jason Tisdale, massive days. So I think that's around the corner. So I'm beyond excited. I mean, I'm almost like Dean and I have joked about this. We almost are nervous about getting too excited, because that's why I asked that question at the end. It's a question I always ask. I asked it in Mexico. I asked it with Energy. I asked it with Peru and Colombia and every service. Tell me the cons. All right, good. That's good. I get it. But what are some of the negatives? And so some of the negatives, the positives seem to outweigh the negatives. So yeah, right now we just got to get people lined up. This call is going to get, it's recorded, so you'll be able to hear this call again. We saved the chat, so all the questions, hopefully we're going to put on a PDF, and we'll have the questions and everything answered. So that's all I got. Dean, if there's anything else you want to add?
No, we are good. I'm grateful that we're able to do this. I appreciate everybody's time. I can't imagine that everyone on this call does not think that this was worth their time. You guys, this is just one of those windows of time where there's a whole bunch of people that have been patiently waiting and working towards a window of time like this. And some of you are just in the right place at the right time because of the timing of you getting started. So how we can use this to build our business, impact a whole bunch of people, and build something significant. There's no way to over promote it. I just think that that's the window of time that we're in. So it's time to get after it.
Yeah, I'm reading the chat, like Ray, for instance. Yeah, he said, at $140 commissionable revenue at 20%, that's $28 a month, one customer. That's crazy. So yeah, you can play around with these numbers. I'll tell you, the more you play around with these numbers, you're not going to sleep. The more you play around with these numbers, you'll get super excited. So next to me is my wife, who has not said anything in a presentation in a long time. So I'm super excited that she wants to say something. Go ahead.
Hi, everybody. I'm Krissa, for those of you who don't know me. I'm the other half, right? So like a friend gets excited about certain things. I get excited about certain things. So I just want to put my little 2 cents in, and that being that this is something that can be really exciting for your team. And I could see people going out there and getting really salesy. And so I would just really encourage you to come from a servant, like a heart-led servant leader. Like, this is how I can serve you, versus like selling, because it's going to sell itself. All you have to do is just simply
have any orange tree?
Just simply share that this is an option for them, and then let Impact do the work for you, so that you're not being salesy. Because a lot of times we just get in our own way and we get excited. And so I would just encourage you in the next weeks and months to really just build your network, just build your lead pools. And so that when you're able to roll it out, like, start thinking about all the realtors, start thinking about all the people who are entrepreneurs who are not in your business, and that you're not going to go out there and try to recruit them. Like, let it all happen naturally, because you have a great product, because you can now help so many more people. So that would just be my encouragement, just to see, like, this is such great value that you can offer and serve people, whether they're in your team or not. And it's just a new service that you get to add to your what do you call it, offering. You have a lot to offer, but this is anybody, it can benefit so many people. We've been with a Healthshare company for over 12 years, so we can speak with conviction. It works. And the other thing is just like Energy, they sign up, or cell phone, they sign up and they forget about it. So you've got years of billing to come. So that's my 2 cents. I gotta go. See y'all later.
Thank you. Yeah. Great question, Eugene. A comparison between traditional health insurance and Impact. We'll make sure we get all that ready to go. So thank you guys so much. Thanks, Dean. Thanks all the other RVPs that jumped on. And so this, we'll get this recording sent out. I think we have 2 different recordings. We'll get it blasted out so you can listen to it. So you guys have a great day, and we'll keep in touch. Have a good one.
Thank you.
Thank you.
Thank
This
you,
was
Efren and
amazing.
Dean.
Thank you.
Have a great day.
Dean, thank you, Efren.
Thanks, Efren. Awesome.
Thank you.